Dear students, so we are coming to the end of psychology unit, that is various test and assessment. Already you have learned various chapters like emotion, stress, motivation, attitude, aptitude, personality, learning, thinking. So these all have some or other way to assess, and some way we have learned about these various tests. But being a nurse, we cannot do all the tests to our patient because we are not certified psychologists, but still some assessments can be done along with them. It is also an important chapter. For some short note it may come, like what is assessment? Psychological assessment. It is a process of forming an overall impression or judgment about the psychological makeup of a person, including his personality, behavior and adjustment through some semi-structured techniques. So already we have learned various questionnaires. In the personality also I have taught you about questionnaires, then various like rating scales. These all are different types of assessments. So we are doing to understand whether they are having good personality, whether which type of personality they are having, what aptitude test they are doing, what is their attitude, or any form of examination or test psychologically we can do by this technique. Psychological test is the technique to generate the sample of behavior making inference about psychological attribute of the people being tested. It is a standardized procedure because everywhere it is accepted and these principles has to be followed. In the personality test also we have seen various tests like Inkblot test, thematic apperception test. So those tests are standardized and everywhere we can use this test quantitatively or qualitatively, because this non-verbal behavior or non-verbal behavior can also be assessed. Simple interview itself is a psychological test. You are interviewing your patient and understanding the personality itself is a psychological test. So one is various types are there. One is achievement test. Achievement means what the person has achieved or not. Personality test, already we have learned about personality trait. Then aptitude, different aptitude. For example, you might have underwent any competitive exams after your 12th, like NEET examination, SET examinations, or anything to get admission into a medical course. So that is aptitude test. Or to go for any mechanical test, artistic or clerical, managerial skill, if I want to apply for any job, there may be some aptitude questionnaires will be there, some examination will be there. Based on that, I will get been selected. Interest, maybe about my interest also can be checked. What is my interest about gardening, my literacy or social work, anything. Attitude, like attitude test, already I have taught you about attitude, which attitude you are having. Thurston scale, my attitude towards HIV positive person, whether it's a positive attitude or negative attitude. One example I taught you in attitude, you can just check out that. Like mobile phone use should be prohibited in the campus. It should not allow in the campus. What is students' attitude towards that? It should be 1, 2, 3, like accepting, not accepting, or not sure, like that. Okay. Then intelligence also you might have learned about IQ test. Various IQ tests are there. So there also you can assess the person's intelligence. Then mood also we can check, like mood or motivation, like whether the patient's mood is there. Mood means how are you feeling today. Ask the patient, are you feeling today good or not? So mood is subjective expression of emotion. Neurophysiological test, ability to think, speak, reasoning. Maybe some patient have stroke or paralysis. They lose something from the brain is damaged, they are not able to memorize. So memory test can be checked. What is the time now? Who all are there in your family? Can you just remember the name? What happened to you? Any accident? After any accident also, like they may got any head injury, they may forget everything. That is amnesia. Then specific tests also are there. These are available with the psychologists, even psychiatrists also. Some they are doing, like anxiety scales are there, depression scales in the sense there are some questionnaire. Based on questionnaire you have to ask the patient and you have to see whether they are depression, how much depression, whether mild, moderate, severe or more severe. So what are the characteristic features when we prepare such test? Even in nursing research also, people do some research activity, they prepare their own test. So based on that, like it should be objectivity. Already I told you many times about objectivity. Objectivity means we should not have any subjectivity. We should be partially free. Biased should not be there. Question should be objective. It should be ability, judgment ability, skill, knowledge to be measured. Free from judgment. I should not judge. This person is nursing student, so I should not ask anything related to brain. Brain is related to nervous system, and nervous system is learning by neurologists. Nursing students won't understand. No, this is not like that. You have to be very much objective. Reliability. Reliability means whether your results are consistent or not. If I prepare some questions, for example, if I prepare some psychological questions, psychological test for my patient, maybe simple example about mobile phone attitude. If I want to check the attitude. So I suppose I prepared 5 questions on the mobile phone attitude about students. What is the student's attitude about mobile phone? Whether it should be allowed. My first question will be whether it should be allowed in the campus. Then my second question there may be like, no, mobile are not good for students. Third may be that mobile is hampering their health. Fourth question may be like mobile phone is good, not good for mental health also. So on. I can prepare many questions. So I will check this question with some student through some reliability formulas that you will learn in research only. This year is not important for you. So reliability formula can be checked and I will see how much it is consistent. Simple example, I can share a measuring tape. You know, when you go to a tailor, what they will do? They will measure your size of your shirt. Maybe the collar size, your shoulder part, your arm size, everything they will see, they will measure it. So that measuring tape is reliable. You can rely to that measuring tape. If you go to another tailor, so your measurement will change? No, it will not change because measuring tape is reliable. Though the measuring tape is different, but it is standard one. So that is simple meaning of reliability. It is trustworthy. Validity also we have to check how much valid. Sometimes we always check validity, expiry like that, no, whether it is expiry date is there or not. Same way validity, this mobile phone is valid up to this much year, or this mobile SIM card or this debit card, this credit card is valid for this much year. So what is validity? The duration. So that can be also checked with the help of like for example, if I want to check the intelligence question, I have prepared 5 questions to check the IQ. So the 5 questions I have to give somebody to check the validity, whether this question is assessing or not, whether the question is from intelligence or not. Sometimes what happens, the question may not be from intelligence chapter, it may from another chapter, it may not related to intelligence. So that means that question is not valid. So checking is very important. Validity. Practicability. Practicability means the completion, the length of question, scoring, everything should be practicable. If I have prepared 5 questions, I should score that. Each question carry 1 mark. If it is not, then I should give in that explanation also. How much they have to write. If I have given space, I have to write that you have to write about nursing in 5 to 10 words. So something like that. Even for psychological test also, it should be practicable. How to develop psychological test. First step is preliminary preparation. As a basic preparation, we have to check, you all should have the scope. For example, if I am having patient related to personality disorder, so my preliminary step is related to personality only. I have to see what are the available resources, where I can get the personality questionnaire, or what are the scope of this test. Once I administer this test, what is the scope, whether I will be able to achieve my objective. Second is you have to select the items. Items means questionnaire. This is very important. Items means questionnaire. That questions or statements we can say. So I have to just see whether I am preparing a draft of questionnaires to be prepared. Then I will administer. To a small sample, that is known as pilot project. I suppose I will check for 10 people. So 10 people, maybe 10% of the main sample can be taken. If I want to administer this questionnaire to 1,000 of people in a community about to checking the type of personality, so 1,000 will be my sample size. Okay. So for the first thing I will do as pilot project. So pilot will be done for 10%. So what is 10% of this 1,000? So 10 into 1,000 divided by 100. So what will be answer? 100. So first I will select only 100 people. I will do this test. I will see how much it is practicable, reliable or valid. Then if I am successful, then what will happen? I can administer to 1,000 people. So that is piloting. It should be done for a small sample of project. Then we will go for analysis for the final draft. I will do Finally, I will giving all the scoring. I will see what are the strength and the weakness, and finally I will administer this draft to a large people, that is thousands people. So pilot project is very important. Then from the pilot project you can understand the weakness. Sometimes what happen, I administer to 10 people. See the example only. 1000 is my main sample. This is my main sample. But for a small sample, I have selected 10%. That is 100 people. This is just an example I am giving. So I will see what are the strength or weakness, what problem I have faced. Maybe I have not got response. Then I can change my questionnaire before administering to the main sample. So these are various principles to be followed. So till now we have seen why this is important, what are various types and which are the various steps. Now the principles, like principle of competency, the tester who is going to test, they should have knowledge. The principle of knowing the person to be tested. I should know this test given to whom. If I want to check the attitude of students regarding mobile phone, usage of mobile phone, that attitude test, then my sample or my people or my person will be only students, not the adult. So that is also important. And next you have to consider the age, sex, education, everything, their background also, and you have to select a suitable test according to their need. If I want to administer question about attitude of the students regarding mobile phone, then I will select only the students. Then I have to think which age group. To every student? No, only college student. Which sex? No, every sex, like each sex, male, female, irrespective of that. Education, yes, all the students who are going to college, maybe nursing, engineering, medical, anybody I can ask, or any social customs are there. So based on that you will put the test. Then you should have proper scoring. I should have marks for each question. They may get some scoring, and based on scoring we will calculate, and based on that calculate we will give the proper interpretation. The attitude of the student was positive or negative or in between. So this way we go doing the test. Already I told you about the purpose of that test, and still again I repeat the use for psychological test, because we have to identify relation or strength and weakness. Then we have to apply for the educational professional courses. For example, if I want to get admit into my course, so there I will get into a interview or maybe some examination, then I will get admission. So that is aptitude test. Or any recruitment, if I want a job, so job also, some job they have interview or examination, aptitude test. Or if I want to understand my student is failing too much, so what is my problem of student, so adjustment test can be done, or any motivational test can be done, such test. Or you can help the person to take any measurement. If I identified my student having problem in their education, then I can give some measurements to them. I can provide proper guidance and counseling. I can integrate body and mind. Even it will help me to find out some research. So based on the research, I can find that mobile phone is not good or mobile phone is bad. Whatever it is, I can do. And role of nurse is very important, because we have to see all the changes in the behavior of the patient, their mood, their behavior, whether they are having any stress, anxiety, phobia, fear or mood swinging, or you can assess the person. If you find your patient is having any issue, then better you go to that patient and you have to treat, and you should administer particular test and identify whether the person is having intelligent issue, whether the person is having personality issue, or whether there is any aptitude issue, attitude issue, and you can, based on that, you can give counseling. So this is like a preliminary step, we can say, to identify, to confirm their diagnosis, and you can plan the recreation occupational training, as well as you can even nurses, those who go for higher studies and those who want to research. In your 4th year you may have research subject, so there also you may do some research studies. There you will apply various psychological tests like this questionnaire, rating scale, checklist. Then you can go further studies also, any research studies, I mean, like how the theories have been developed, learning theories. All the theories have developed these theories based on the research only. They did the research on animals, human beings, then they applied this, then they applied to the human being, then finalized and proved this. So thank you so much for this topic, because it's very important to understand various tests, enlist the principles, and what are the use of psychological tests, and what is the nurse's role, because these tests we feel able to do, we can apply to our patient, and based on their problems whatever we are identifying, we can take care and we can put remedial measures on them so that their mental health can be restored. I wish you all the best to do a proper psychological test. Thank you.